Managing patients better, treating emergencies on top of COVID, and self-care. That's what hospital staff at Barnes Jewish is telling News 4 that they've had to learn to deal with better in the last year.
Our Jenna Ray talked to the chief of the hospital's emergency department about the last 365 days. Jenna?
That's exactly right. Just over a year ago, we saw the very first positive COVID-19 case here in St. Louis. The public scrambled to get toilet paper and masks while doctors, nurses, and other hospital staff fought to keep patients safe, alive, and as well as themselves every single day.
We don't know necessarily what each day will be like. Anything and everything can walk through the front doors, and we always have to be prepared.
Dr. Robert Poirier, emergency department chief at BJC, tells me preparation is what got him and his staff through the tough moments of fighting COVID-19 and treating more than 80,000 patients who came through the ER's doors this last year.
We were still seeing patients that were hurt in car accidents and shootings and having heart attacks and strokes that weren't necessarily COVID. But in the emergency department, we always have to look at somebody as if they might have COVID.
On top of an influx in daily patients, ER staff had to maintain new safety protocols while learning to treat a disease they knew little about.
Having to reuse equipment is something we weren't used to in the past and really haven't had to do before. But we quickly got used to it. And once we saw that our staff was not coming down with COVID, we gained confidence that what we were doing was working.
It's been a long haul and it's still going. However, he says his staff took on a burden that's now being better dealt with.
It's just learning what needs to be done to recognize compassion fatigue and burnout, what we can put into place to help reduce it, and build resilience.
Overall, the ER chief tells me he feels confident his staff and the rest of the BJC staff can better treat COVID now than they were a year ago. He says he recommends everyone get a vaccine and says that what's going to get us to the finish line is getting that shot.
All right, Jenna, thank you. New at 5.